Assalamualaikum warahmatullahi wabarakatuh and have a good day everyone. I am Omelher Gindawali Haji Nabil. I will be discussing about the preoperative care for patient undergoing orthopedic surgery. Now let's start. What is preoperative care? Preoperative care is care given before surgery when physical, psychological preparation are made for the preparation according to the individual needs of the patient. The preparative period runs from the time the patient is admitted to the hospital or nursing center to the time that the surgery begins. These are the rules of nurses in the preoperative phase. First, obtaining informed consent. Second, preoperative assessment. Third, preoperative teaching. Fourth, physical preparation of the patient. And fifth is psychological preparation of the patient. For the preoperative assessment, includes the following: review preoperative laboratory and diagnostic studies, review the client health history, assess physical needs, assess psychological needs, and last is assess cultural needs. For the review of preoperative laboratory and diagnostic studies include the following: complete blood count, blood type and across match, serum electrolytes, urinalysis, chest x-ray, electrocardiogram, and other tests related to procedure or client medical condition. For the review the client health history, they are the history of present illness, past medical history, medical condition, acute and chronic, previous hospitalization and surgeries, history of any past problem with anesthesia, allergies and present medication. For the assessed physical needs, ability to communicate, the vital signs, level of consciousness, weight and height, ability to move or ambulate, level of exercise, prosthesis, and circulatory status. For the assessed psychological needs, they are the following: emotional state, level of understanding of surgical procedure, preoperative and postoperative instruction, coping strategies, and support system. For the last, assess cultural needs, assess for the language need for the interpreter. For the second rules of nurses and the preoperative phase is the obtaining informed consent. Before surgery, the client must sign surgical consent form or operative permit. Client must sign a consent form for any procedure that requires anesthesia and has risk of complication. And if an adult client is confused and conscious, a family member or guardian must sign the consent form. And next is, if the client is younger than 18 years of age, a parent or legal guardian must sign the consent form. And in an emergency, the surgeon may have to operate without consent. Healthcare personnel, however, makes every effort to obtain consent by telephone or fax. Each nurse must be familiar with agency policies and state laws regarding surgical consent form, and client must sign the consent form before receiving any preoperative sedatives. And last is the nurse is responsible for ensuring that all necessary parties have signed the consent form and that it is in the client chart before the client goes to the operating room. And the third is preoperative teaching. They are including the following: teaching client about their surgical procedure and expectation before and after surgery is best done during the preoperative period. Next is client are more alert and free of pain at this time. Last is information in preoperative teaching plan varies with type of surgery and the length of the hospitalization. And for the preoperative teaching plan include the following: preoperative medication, postoperative pain control, deep breathing and coughing exercises, use of incentive spirometry, how to support the incision for breathing exercises and moving, and position changes, and last is feet and leg exercises. And next is physical preparation of the patient, include the following: the nutrition and fluid, elimination, hygiene, medication, sleep, care of valuables, prosthesis, special order, surgical skin preparation, safety protocol, vital signs, and anti-embolic stockings. They are the nursing process for preoperative care of the patient undergoing orthopedic surgery. For the assessment of the patient is focused on hydration status, current medication history, and possible infection. Adequate hydration is an important goal for orthopedic patients. Immobilization and bed rest contribute to DVT, to urinary stasis and associated bladder infection, and to kidney stone formation. Adequate hydration decreases blood viscosity and venous stasis and ensure adequate urine flow. To determine preoperative hydration status, the nurses assesses the skin and mucous membrane, vital signs, urinary output, and laboratory values. The medication history provides information for preoperative management. The patient with chronic illness such as rheumatoid arthritis, chronic pulmonary disease, multiple sclerosis, and allergies frequently has received corticosteroid medication to control symptoms. The nurses ask the patient specifically about the occurrence of cold, dental problems, urinary tract infection, and other infection within the 2 weeks before surgery. Osteomyelitis could develop through hematologous spread. Permanent disability can result if infection occur within a bone or joint. Pre-existing infection must be resolved before elective orthopedic surgery is performed. And for the nursing diagnosis, based on the nursing assessment data, the patient measure preoperative nursing diagnosis. Diagnosis related to orthopedic status may include the following: acute pain related to fracture, orthopedic problem, swelling or inflammation, rest for peripheral neurovascular dysfunction related to swelling, constricting devices, or impaired venous return. And next is risk for ineffective therapeutic regimen management related to insufficient knowledge or lack of available support and resources. Next, impaired physical mobility related to pain, swelling, and possible presence of an immobilization device. Last is risk for situational low self-esteem, disturbed body image, and or functional impairment related to impact of musculoskeletal disorder. For the planning and goals, the major goal for the patient before orthopedic surgery may include the relief of pain, adequate neurovascular function, health promotion, improved mobility, and positive self-esteem. They are the nursing intervention, relieving pain, physical, pharmacologic, and psychological strategies to control pain are useful in the preoperative period. Specific strategies are tailored to the individual patient. Discomfort is decreased with immobilization of fractured bone or an injured, inflamed joint. Elevation of an edematous extremity promotes venous return and reduces associated discomfort. prescribed. Ice, if prescribed, relieves swelling and directly reduces discomfort by diminishing nerve stimulation. Analgesics are frequently prescribed to control the acute pain of musculoskeletal injury and associated muscle spasm. During the immediate preoperative period, the nurses need to discuss and coordinate the administration of analgesic medication with the anesthesiologist and surgeon. For the maintaining adequate neurovascular function, trauma, edema, or immobilization device may interrupt tissue perfusion. The nurse must frequently assess neurovascular status, the color, temperature, capillary refill, pulses, edema, pain, sensation, and motion of the extremity and document the findings. If circulation is compromised, the nurse institute measures to restore adequate circulation. This includes promptly notifying the physician, elevating the extremity, and releasing constricting wraps or casts are prescribed. For the promoting health, the nurses assess the patient in activities that promote health during the period. During the preoperative period, the nurses assesses nutritional status and hydration. The preoperative fasting regimen is usually tolerated well. If the patient has diabetes, is elderly and frail, or is the victim of multiple trauma, special fluid and nutritional provisions may be necessary. The nurse monitor fluid intake, urinary output, urinalysis findings, and complaint of burning on urination. At times, patients may limit their fluid intake to minimize the use of bed pan. A small fracture pan may be more comfortable for the patient to use. An indwelling catheter shall be used only when absolutely necessary to minimize the risk of urinary tract infection. Urinary tract infection must be addressed before surgery. For the improved mobility, preoperatively, the patient's mobility may be impaired by pain, swelling, and immobilizing devices, splint, cast, and traction. The nurses should eliminate and adequate support edematous extremities with pillows. It is important to control pain before an injured part is moved to administering medication in time for it to take effect and by supporting the injured part when it is moved. The nurse encourages movement within the time of therapeutic immobility. The patient should perform active range of motion exercises of uninvolved joint and unless contraindicated. The nurses teaches gluteal sitting and quadriceps sitting isometric exercises to maintain the muscle needed for ambulation. The patient who will be using assistive devices post-operatively may exercise to strengthen the upper extremities and shoulder. The use of assistive devices such as crutches, walker, and wheelchair is anticipated. The nurse encourages the patient to practice with them preoperatively to facilitate their safe use and to promote earlier independent mobility. For the helping the patient maintain self-esteem, preoperatively orthopedic patient may need assistance in accepting changes in body image, diminished self-esteem, or inability to perform the roles and responsibilities. The degree of assistance required in this area varies greatly, depending on the event preceding hospitalization, the surgery and rehabilitation plan, and the temporary or permanent nature of the problem. The nurse promotes a trusting relationship for patients to express concern and anxieties and help them examine their feelings about changes in self-concept. The nurse clarify any misconception patient may have and help them work through modification needed to adapt to alteration in physical capacity and to reestablish positive self-esteem. For the evaluation, patient outcome is expected patient outcome may include the report relief of pain, the uses multiple approaches to reduce pain, state the medication is effective in relieving pain, move with increasing comfort. The next evaluation is the exhibit adequate neurovascular, exhibit normal skin color, has warm skin, has normal capillary ripple response, report normal sensation and demonstrate joint motion, and last is demonstrate reduce swelling. For the promote health, eat balanced diet appropriate to meet nutritional needs, maintain adequate hydration, abstain from smoking, practices respiratory exercises, reposition self to relieve skin pressure, engage in strengthening and preventive exercises, plan for assistance during convalescence at home, and the next is maximize mobility within the therapeutic limits. Request assistance when moving, elevate edematous extremity after transfer, and uses immobilizing devices and assistive devices are prescribed. And lastly, expresses positive self-esteem. Acknowledge the temporary or permanent changes in body image, discusses real performance changes, participate in decision about care. And that will be all. Thank you.